To begin with, I request Mr. Evan Samas, Scientist, Traffic Engineering and Safety Division at NATPAC, to deliver the welcome address. Over to you, sir.
I welcome everyone to the TransTech talk series. First of all, I will like to welcome Priyanka Alluri, Associate Professor, Florida International University. We welcome you, ma'am, to the technical talk series. In the short notice, ma'am has agreed for presenting her expertise and experience in this talk series. I would also like to welcome Dr. Samson Matthew, our director, who has been a backbone for driving this talk series. Welcome you, sir. Then I would like to welcome our RC member, Dr. Velmurugan, sir, from CRRI. Sir has been a guiding force throughout our research activities of NATPAC. Welcome you, sir, to this talk series. Also, we have invited various stakeholders, departments, and agencies who are attending this program, welcoming you all to this talk series. And also, I would like to welcome all staff members of NATPAC who are in Thiruvananthapuram and regional centers in Ernakulam and Kozhikode to this talk series. Also, I would like to welcome all other participants to this talk series.
Thank you, sir, for your warm welcome. Next, I would like to invite Dr. Vasudevan N., Junior Scientist, Traffic Engineering and Safety Division at NATPAC, to introduce our esteemed speaker to the audience. Over to you, sir.
Good evening to everyone. Today we have Dr. Priyanka Alluri, Associate Professor, Department of Civil and Environmental Engineering, Florida International University. Dr. Priyanka Alluri is currently an Associate Professor in the Department of Civil and Environmental Engineering at Florida International University. She received her doctoral degree in Civil Engineering from Clemson University in 2010. During Alluri's research area, Dr. Alluri's research areas have included highway safety, traffic operations, and connected vehicle technologies. Dr. Alluri has served as the principal investigator for over $6.5 million US. Her research has resulted in 75 peer-reviewed journal publications. Dr. Alluri has also published over 90 peer-reviewed conference proceedings, 55 final research reports, and an elsewhere book on connected and autonomous vehicles. She has served as the major advisor for 6 doctoral students and numerous MS and BS students, an active member of the Institute of Transportation Engineers, ITE. Dr. Alluri is currently serving as the chair of the ITE Safety Council. She also serves as the faculty advisor for the FIU student chapter of ITE. The topic for today's talk series is improving transportation safety, bridging the gap between research and practice through the 4 E's. The presentation explores the concept of the 4 E's in transportation safety, that is engineering, education, enforcement, and emergency medical services from a researcher's perspective. It discusses a few research projects carried out in United States where the study results are directly implemented by practitioners to advance safety. With this note, I welcome Dr. Priyanka Alluri to this talk series. Madam, over to you. Thank you.
Thank you. Good evening, everybody, and thank you so much for a warm welcome and wonderful introduction. And also, I want to thank the team. As I mentioned, it was a very short notice. I couldn't.
Sorry to interrupt. The audio is not somewhat missing.
You can't hear me? Okay. Can you hear me now?
Yeah, that's fine.
Okay. Sorry. Yeah. Thank you so much. Yeah. Good evening, everybody. I'm Priyanka. I would like to thank you for giving me this opportunity.
I think you need to come maybe closer to the mic.
Oh, really? Wow. This is the first time this is happening. I use this computer all the time.
Yeah, now it's fine.
Fine. Okay. Just need to talk loud. I hope I don't wake up my son. Yeah, good evening, everyone. I'm Priyanka Alluri, and I would like to on this topic. In fact, when I was contacted to present, I always say yes to my colleagues from India because obviously I'm from India. Back to the country. So I was thinking what to talk, and I thought that maybe I talk about safety. And here comes the topic. And actually, I was excited to hear that Dr. Pulugurta was the first speaker on this TransTech series. I mean, he's a good friend of mine. I mean, we collaborate quite a bit on a few projects. So, yeah. Anyways, it's a small world. That's what I want to say. So in this presentation, I would always like to give a little bit of background about me and what I do, and then talk about the research areas. And since audience are from from India, I wanted to bring traffic safety from a global perspective in the context of the E's. And the 4 E's, as I mentioned on this slide, are the engineering, education, enforcement, and emergency medical services. So I've done research projects to talk about a few of these research projects and how the sponsors and the stakeholders are using these research results in order to advance safety. About me, I mean, I did my engineering in 2006. Okay, my voice is not clear. I don't know. So
It's breaking at times.
okay, is it better? It's not better. Is it better? All right. Oh, maybe can you give me like maybe 2 minutes?
Yeah. Yes.
Samson is here today or is in office?
Samson sir.
Well, Murugan, I'm not there in the office today.
Okay.
I'm not. In fact, last 2 days I was traveling, and today I'm at my native place. That's why I couldn't
Okay.
next 2
Joined
days.
online. Okay.
Yeah, I joined online. So how are you?
I'm good, going good. Everything going good. For her, time is early morning, no? Early morning, 7:15, I suppose.
Yeah. 7 o'clock.
Yeah.
We don't use.
Sanjay, Road Safety Authority people are also attending. We should
Yes, sir.
welcome them.
Nichu
Also.
and Kalan, yeah.
Should welcome them.
Hello.
Vin, don't forget
Yeah.
Niju and Kala.
Yeah, sir, we are here.
Yeah. Welcome for that talk.
Thank you so much, sir.
Okay, can you hear me?
Yeah.
Yes, ma'am.
Now it's clear, I suppose.
Oh, okay, perfect. So I'm using my laptop for the audio, and let me use my desktop for the video because I don't have my computer on my presentation on my laptop yet. So it's okay, we'll make it work. So I just screen share. Okay, so you can see my presentation, right?
Yes.
Okay, perfect. Thank you. Okay, so sorry for that hiccup. Yeah, technology sometimes, is tricky. But anyways, so let me just briefly talk about my where I'm coming from and what I've done so far. So I've done my engineering in 2006, and then pretty straightforward my career path. MS in 2008 from Clemson University, and PhD in civil engineering from 2010. I did a postdoc for a year at Clemson, and then I was for a year at Clemson, and then for 3-4 years at FIU, and then I'm on a tenure track assistant professor in 2015. I'm a tenured as an associate professor now, and hopefully I'll become a full professor soon. So this has been my journey, my professional career. So again, I want to touch base on what I do every day at FIU. I believe it's the same case in India as well, at universities in India as well. But here we focus on the 3 pillars of academia. That's what we call them: research, teaching, and service. So with respect to the research, I'm fortunate enough to have quite a few grants and about $6.5 million in research, and I currently have about 12 ongoing research projects that keep me pretty busy. Journal papers, I have 76. In fact, in my bio, I had 75, and one got accepted in the last 3 days. So I have 76 journal papers and 90 conference proceedings and about 55 research reports. And currently I have 4 research associates. I've graduated about 6 PhD students, but I currently have 12 PhD students in my group and about 12 BS students. Quickly about my research areas. Broadly, my research area focuses on safety and traffic operations. But when we dig into the safety or operations, I focus on these are the 4 crux or thrusts of my research areas. I do research in ITS, Intelligent Transportation Systems, and TISMO, which is Transportation Systems Management and Operation Strategies. I also do a little bit of research on connected vehicles. In fact, I've co-authored a book on connected vehicles. It's expensive, so I don't recommend you to. You could buy it, but maybe your universities could buy it. I also do research in pedestrian safety and advanced safety models, and also on wrong way driving. And my research collaborators, I collaborate quite a bit across the United States. I have funded research projects from Florida, from National Science Foundation, and from the South Dakota Department of Transportation. And I collaborate with several local agencies like the City of Doral, City of Miami Beach, and also several universities in and around, I would say, Southeast United States, We have, University of North Florida, University of South Florida, UCF, University of Central Florida, Georgia Tech, University of Florida, Texas Transportation Institute, TTI, my alma mater, Clemson University, and so on. With respect to teaching, I believe, I only teach 2 classes. I teach highway geometry design for the undergrads and also highway safety analysis for the grads. And with respect to service, again, here at FIU, service forms a bigger part of our day-to-day job. So here I'm a part of several national and international organizations, and some of them are the ITE, Institute of Transportation Engineers. In fact, I'm the chair of the ITE Safety Council. If you are interested, we host quarterly meetings. I mean, 2 would be in person and 2 would be online. And if you're interested, I could send you the meeting invitation link and you can join and just listen into the conversations pertaining to the safety at the national level. I'm also a member of the ASCE, TNDI, NCHRP, Transportation Research Board, WTS, and KSCSTE. And I am nothing without my students. So here are some of the pictures of my student, at different conferences, presentations, awards, etc. So with that background, let me dive into the topic of today's presentation. And I was a little bit not sure what to present because most of the research that I do is very, very much US specific, where we focus on, say, the freeways and express lanes in Florida or across the country in Texas or South Dakota, for example. But I wanted to make sure that I present something that you could relate to, that you could you could relate to and understand and apply, for example, in India. So I looked at some of the statistics. I mean, it's been a while since I've moved here, so I don't know much about the statistics across the globe or in India, but I did kind of like find some statistics and found that about 93% of all fatalities worldwide occur in low and middle income countries, and which is quite shocking to me when I realized that. And I was thinking about India in particular, and I realized that, I mean, I don't visit India that often, so I don't know much, but I've realized that India's infrastructure, especially the roadway infrastructure, has been increasing by leaps and bounds, and also the number of registered vehicles. And with this growth, as steep of a growth as it is, I believe that safety and mobility concerns are only going to exacerbate and increase with time. So we as researchers have to find ways to improve safety so that we have, I can't say zero, but we have as fewer traffic fatalities as possible. And this is a staggering statistic, which I actually could not believe it unless I had to read it a couple of times, is that 1 in traffic fatalities worldwide is in India. And again, this reinforces the need for us researchers and also practitioners to find ways to improve safety. And then I always believe that we need to bridge the gap between research and practice, because I don't believe that, as researchers, all we do is get funding, do dissertations and publish in reputed journals, and that it doesn't end there. We have to find a way so that the practitioners, by practitioners I mean the government agencies, the cities, the local agencies, should somehow find a way to use those research results in order to improve safety. Because it can be done overnight. I mean, you can't say that, okay, today we have 40,000 fatalities in the US, tomorrow it's going to come down to 10,000. It's not going to happen. I mean, we need to find ways in order to improve safety. And this is one table that I found about the fatalities in India in 2019 and versus 2020. As we all know that We had COVID during 2020, and as a result, we did see a reduction in crashes and reduction in fatalities, a reduction in injuries. So when you look at it, you could say that, yeah, I mean, the reduction is a lot. So can we say that we improved safety? Yes, we could if you just go by the frequency numbers. But when we look at the severity rate, the rate of fatalities for whatever metric that is, for usually say per 100,000 population, or per 100 million vehicle miles traveled, or in this case per 100 accidents, you see that actually it increased. So 2020, depending on the numbers you look at, they either, you could say that the safety either improved or safety either reduced. So I give sometimes these examples just to reiterate that as safety engineers or as safety researchers, we should not cherry pick the data that we want to use. You know, it depends on how you present the data. You can tell a completely different story. I'm not sure if you're aware of this, but I want to say that US is one of the worst countries among the developed nations with a very high fatality rate. As you can see, this graph has the number of traffic fatalities from say 1975 to 2021, and as you can see, it's a lot of fatalities. And we zoom in, we see that every year we are losing in the United States over 40,000. In fact, in 2021, we had over 47,000 traffic fatalities, which is an unacceptable number, because that is I think it's one every 8 minutes or 10 minutes, which is a lot for a developed nation. So with that background, I just want to reiterate that safety has been a very, very important dynamic or important a factor in the United States, not only for the United States Department of Transportation, but also for the state agencies, the Florida Department of Transportation and the local agencies. So now coming back to the crux of my presentation today, what is road safety? And the definition of a road safety depends on whom you ask. If you ask a public health official, you have a different definition. If you ask a psychologist, you get a different definition. But if you ask a police officer, you get a different definition. But as a safety engineer, this is the definition that I can relate to with, and that is that it says that the road safety is the number of accidents, and we are actually moving away from the word accidents and we are calling it crashes. So it's the number of crashes or crash consequences by kind or severity expected to occur on the entity which is on the roadway or an intersection during a specific period. Maybe it's 1 year or 2 years or 5-year period. So this is the definition, and what we try to analyze and do research on at FIU is to reduce the things that are highlighted, for example, that is to reduce the number of crashes and to reduce the number of crashes by severity and also by kind. By kind, what we mean is say crash type. It could be pedestrian crashes, it could be angle crashes, head-on crashes, intersection crashes, you name it, and expected to occur on the entity. So we analyze based on different functional classifications. Say, for example, expressways, we analyze them separately compared to local roads and during a specific period. And this is one more staggering statistic, which I'm not sure if you're aware or not, but when we look at traffic safety, I mean, this is a very old reference from 1996, but what we found is, it is still true even to today, is that human factors like the drivers or the pedestrians or people, they contribute to 95% of crashes. And roadway environment contributes to 28%, and the vehicle factors like say blown tires, wipers not working, or recently it's the robo taxis or autonomous vehicles, with all of those factors, they contribute to 8%. This actually I got it from the Indian Ministry of Road transport and highways policy, and where the policy talked about safety as a holistic approach, and it is not just safety is never in silo, and that is the reason of my the reason behind my talk here, which is focusing on the 4 E's. So this holistic approach focuses on establishing safety infrastructure database, the 4 E's, the conducting research on road safety, and also strengthening the policy perspective or policy aspect of transportation safety. And again, as I said, actually, I'm pretty impressed with how the universities in India are increasingly focusing on research, particularly in improving transportation safety. And we have, again, a part of the holistic approach, we have the 4 E's, which we'll be talking about in this presentation. So what are these 4 E's? The 4 E's constitute the engineering, the education, the enforcement, and emergency medical services. So among these 4 E's, as safety researchers, we primarily focus on the engineering aspect, but I do some research research projects on the enforcement and the education as well. And I don't think we'll have enough time to touch base on the emergency services, but anyways, these 4 constitute the 4 E's of traffic safety. And now let's talk about engineering. What is engineering? What are the engineering aspects of improving safety? Say, for example, when you look at a roadway corridor, and if that corridor has a lot of crashes, and there could be some ways of so let me take a step back and talk about the 4 E's. Say, for example, if you have an intersection or a segment or just a corridor that has a lot of crashes, and we could improve safety through these 4 E's. That's what I wanted to mention. Say, for example, what could be the engineering countermeasures? Maybe there may be no street lighting, so there are more crashes at night. So one of the engineering countermeasure could be to install street lights, or maybe the lanes are too narrow. So another engineering countermeasure could be to increase the width of the lanes. So those are the engineering countermeasures where we are making changes to the existing roadway in order to improve safety. When we talk about education or public awareness, maybe the public are not aware of the new type of the signalized intersections, or the public are not aware how to navigate through a roundabout, or the public are not aware of who has the right of way when the pedestrians are walking or crossing the street. So there lies the education component that also improves safety in the long run. And we have enforcement, where we have the police on the street to improve safety, to give traffic tickets if somebody is driving over the speed limit or are drunk drivers, etc. And then we have the emergency services, where when we have a crash, we want to make sure that the ambulance or the emergency services reach the patient as quickly as possible. And we call it as a golden hour rule. That means that the chance of a person surviving is very, very high if he or she is taken to the hospital within the first hour, 1 hour of the crash, the first 60 minutes. That is why we as researchers, or as responding agencies, as Department of Transportation, we strive to make sure that the emergency services reach the crash site as quickly as possible. So in this context, I'm going to talk about a few research projects that I have done in engineering, education, and enforcement areas. I do have a couple of projects on emergency services, but I don't think I'll have time to talk about them today. So this is the engineering. So when we talk about engineering, more recently, what I've been doing is to develop crash modification factors. And so the question is, what is a crash modification factor? Say, for example, let me go back to the previous example where I said that maybe the lane width, the lanes are too narrow on a corridor, and so we have a lot of crashes, and we are increasing the lane width. And in the United States, our lane width is the ideal lane width is, or the base condition, if you recall, is about 12 feet. So anything less than 12 feet, we believe that it increases accidents or crashes, and 12 or above is when the crashes kind of like plateau. So okay, let me see. I think everything's okay. Yeah. So so what is a crash modification factor? It is a number. We call it as a multiplicative factor that is used to compute the expected number of crashes after you implement a countermeasure. Say, for example, at an intersection, once you install the street lights, your crash modification factor would be a number, say 0.9. That means that you have a 10% reduction in crashes. So I did put in 3 bullet points here that talks about what the CMF value implies. A CMF less than 1 implies a reduction in crashes, which is good, which is what we want. And a CMF greater than 1 implies an increase in crashes, which is not what we want, but sometimes it happens. Sometimes you try to improve a roadway by implementing a countermeasure, by installing a countermeasure, and it backfires and you actually increase crashes. I mean, not necessarily backfire also, but say, for example, if you install a signal, a traffic signal, traffic light, it reduces, say, angle crashes, but it increases rear-end crashes. So in that case, the CMF would be less than 1 for angle crashes and greater than 1 for rear-end crashes. And then CMF is equal to 1 is also happens sometimes where you don't see a change after that countermeasure is implemented. So as I said, I've done quite a bit of research projects that focus on developing these crash modification factors. And I want to talk about 1 or 2 examples here, depending on time. So recently, I think it was a year or a couple of years ago, we developed the pedestrian crash modification factors for mid-block crossing. What is a mid-block crossing? I mean, usually in here, people cross the street, we walk a lot, so people cross the street at signalized intersections. But sometimes when the signalized intersections are farther apart, or people cross the street at mid-blocks. So we install mid-block crosswalks. So we wanted to see what is the safety benefit, or how many crashes will potentially be reduced if you install a mid-block crosswalk, this one. So what we did was we used the empirical based method using, we developed safety performance functions for pedestrian crashes, and we used a cross-sectional analysis where we evaluated or compared the performance of pedestrian, in terms of pedestrian crashes, the mid-block treatment, which is the crosswalk, versus other locations where you don't have a mid-block crosswalk. And we use the Bayesian zero inflated negative binomial regression models. I mean, we use the zero inflated because we have a lot of locations with 0 pedestrian crashes. So our data set has more zeros than non-zeros. So we needed to use a zero inflated NB model. And I don't want to go into the details, but here are some of the variables that we used. Again, when I do review some of the dissertations or thesis dissertations from India, and what I realized is that it's difficult to get all the data that we need in order to do the analysis. I mean, that's one of the that I would say I'm lucky to be able to use a different variety of data variables in order to develop these safety performance functions in order to estimate the crash modification factors, so that the CMFs are as robust as possible. So these are the different data variables that we use for the model. And this is the final model results. And what we have is, and I only want to focus on the CMF for the mid-block crossing, because we do have the CMFs for other variables as well. But again, as I said, the focus is only, in this presentation, I just want to mention about the CMF for mid-block crossing. And we came up with a number of 0.82. What does that mean? That means that when you install a mid-block crossing, compared to a location where you don't have a mid-block crossing, you will see an 18% reduction in pedestrian crashes. And again, we went one step further to see how confident are we with that number. Can we say for sure that it's going to be 18%? And then what we found is that we are 71% of, there is a 71% probability of reducing crashes by 18%. And this is one of the examples of developing the CMFs and how and practitioners or the Department of Transportation could use this number in order to justify installing mid-block crosswalks on Florida's arterials. I'm going to skip a few slides because it's already 7:40. I have only 20 minutes. So I want to come to the end of the presentation and also leave some time for questions. So, and here is another example of another CMFs. Again, as I said, for the engineering countermeasures, most of my research, or most of anybody's research in traffic safety domain focuses more on developing the crash modification factors or developing the safety performance functions. And this one is a very interesting project where we developed the crash modification factors for something called an adaptive signal control technology. So where we, this is an ASC, this is called ASCD. This is a technology that is used at signalized intersections where the signal lights respond to the oncoming traffic in real time. And it is a much robust application than just the actuated. I'm sure you're aware of the actuated and semi-actuated signals. So it's an advanced technology, much advanced than fully actuated signals. And it, as the slide says, it optimizes signal timing based on the actual traffic demand. And what we did in this one, the previous one, we used a cross-sectional empirical-based method in order to estimate the CMFs, while in this research, we used a before and after empirical-based approach with a comparison group. And we had about 42 intersections with this ASCT and about 47 intersections without ASCT. And here are the CMFs. And I don't want to go into details, but you do have the citation here just in case if you want to take a look at the paper. Okay, let's see. Okay, so those are a couple of examples that I just pulled together actually last night to talk about. But let me also talk about enforcement. Again, as I mentioned, enforcement is where you have the police making sure that the drivers or pedestrians, for that matter, they don't break the laws. And this enforcement does not necessarily need to be from or by a police officer. We have automated, I'm sure these are there in India as well. I mean, automated photo enforced red light cameras, for example, where we are supposed to stop at the red light. Sometimes cannot make a right turn, sometimes cannot cross the intersection at red light. And we have automated cameras that take a picture and send you a ticket home, and it's pretty expensive ticket. I think in Florida it's about $260, which is a lot. So what I was hired by actually the police department at the city of Miami Beach to evaluate the effectiveness of the red light cameras, because it's an enforcement program and the public is against it. Because the public doesn't want to pay $260 tickets every time they skip a red light. So the police department gave this project to me to evaluate the effectiveness of these red light cameras. We call them RLC, red light camera, but here they call it photo red light PRL enforcement program. And we use data on crashes, traffic volume, roadway geometric characteristics, and also traffic control features. We had 9 intersections with red light cameras and 19 without the red light cameras. And we've done Bayesian statistical modeling where 2010 was the base year where where the red light cameras were installed. So we did the 3 years before and the 3 years after. And as you can see, the green light, the green line here, that there is a significant drop in crashes immediately after the installation of red light cameras. And then they kept on increasing, which we found to be pretty expected, because when you have some police presence or when you have these red light cameras, everybody slams on their brakes and everybody slows down just to make sure. And over time, it gets normalized and then crashes creep up. And this is the target for the target crashes, angle and side swipe crashes. And as I said, in like a few minutes ago, I did talk about the rear end crashes. Rear end crashes means the car stops and the person behind them rear ends or hits the car in the front. And those usually increase at signalized intersections because people sometimes they don't know whether to stop or they go, so they slam on the brakes, and the person behind them, they don't know that the person in the front are gonna stop, so they're gonna hit. So as expected, after the red light cameras were installed, there has been an uptick in the rear end crashes. But again, we have to understand that angle crashes are more severe. They result in more fatalities and serious injuries compared to rear end crashes. So it is a trade-off that the city of Miami Beach was okay to make in order to reduce the more serious, more fatal angle crashes and replace them or with less severe, just the property damage only rear end crashes. So here, this is one of the examples of how research could be used by the agencies. In this case, the city of Miami Beach Police Department, to convince not only the public, but also the elected officials to continue the red light photo enforcement red light program. And one more topic that I want to talk about is education, which is also the United States is big as Florida Department of Transportation is big on education. And I'll talk about one research project and then I will pause and have some time for questions. This is a project where we focused more on the education and outreach. The problem is that the pedestrian bicycle safety is a serious concern in Florida. And in fact, Miami is the place where Florida International University is located. And it is one of the top 5 cities in the country with more pedestrian bicycle crashes. So this project, we call it Walk Wise. I mean, it's almost like walking wisely in order to teach pedestrians the rules of the road, to see who has the right of way, who has to stop for the other road user. And the objective was to decrease the pedestrian bicycle crashes in the corridor, bring awareness in the community, educate the public, and increase the user comfort for pedestrian facilities and biking facilities. We have scheduled presentations and we reached out to about 1,500 people. I mean, by 1,500 people, we can't just say that, yes, we went and talked to 1,500 people. We need to get their signatures to prove to the sponsoring agency, to our sponsor, that we did talk to 1,500 people. And also we wanted to reach out to 400 businesses. Businesses means any shops along the corridor, and to talk to them and educate them about pedestrian safety and the rules of the road. And here are the 2 corridors that we focused on in Miami. And these are one is about 2.25 miles and other one is about 2 miles. And what we have, and the dots that you see are it's a GIS map. Where the bigger the dot, the more crashes that location had. As you can see, the 2 yellow lines are the 2 corridors that we focused on. And we did reach out to about, I think, 1,700 people and maybe 450 businesses or something like that. And here is some of the presentations that we have done at different places. We went to the communities, we went to the churches, we went to the schools, we went to departmental stores, to colleges in that regions in order to tell, to convey, to educate them about pedestrian safety. And here are a few more examples of that. And in Florida, I also want to bring your attention to the fact that Florida is also very big on improving safety through what we call them as is the safety coalitions, where we have the group of people from across the state, from different disciplines and different walks of life, but who are Department of Transportation employees, if you will, and the city's employees, to come together in order to improve a certain aspect of safety. So we have a teen safe driving coalition, which focus on teen drivers. Teen drivers, because here people can drive from when they are, I think, 16 years. So 16 to 19 are these young, I would say, called kids who drive and who end up in a lot of crashes. So we have a group that focuses on that. We have a group that focuses on safe mobility for life, which is for older people, which would be 65 years and older. And unlike in India, here people drive till they are 90, 95 years old. So 65 to 95 years, or 65 to whichever the number is, the greater number. So we have a coalition that focuses on improving safety of these older people. And we have a coalition for occupant protection, where we focus on the seatbelts. We have the Alert Today, Alert Tomorrow, which focuses on pedestrians and bicycles. We have a coalition for impaired driving, which is the drunk driving, and where enforcement plays a much more critical role than the engineering countermeasures. And we have the motorcycle safety, which we call it as the Ride Smart Florida. And okay, I think this is more or less my last slide, where in this presentation, I know, I'm sorry that I had to rush, but I just have so much information to talk about. But anyways, in this presentation, I touched a little bit on the 4 E's, which are the engineering, education, enforcement, and emergency medical services. But I want to mention that that the United States and other countries like the Sweden, the Netherlands, the UK, we are moving a little bit away from the 4 E's, because we believe that these 4 E's sometimes they operate as silos. For example, the engineering team does not talk to the education team, who do not talk to the enforcement, and who do not talk to the emergency medical services. So the structure is such that these 4 E's they work in silos. They don't talk to each other. They don't collaborate as much as we would want to. So we're moving away from the 4 E's and focusing more on something called a safe system approach. And this is a safe system approach wheel, where we focus on safer people, safer vehicles, safer speeds, safer roads, and post-crash care. And the writing on the outside, on the circumference of the circle, are the principles of the safe system approach, where we say that death and serious injuries are unacceptable. In other words, we are not saying that we will have 0 crashes in 2050. What we are trying to say is that we'll have 0 fatalities and serious injuries in 2050. And the other concept is that the humans make mistakes, and humans are vulnerable, and responsibility is shared. Say, for example, when a pedestrian is struck by a car, it is not the fault of the pedestrian. It is not the fault of the driver. It's everybody's fault, or the responsibility of improving safety is on everybody, and it is not just on the driver or on the pedestrian. And also that the safety is proactive, which means that we don't have to wait for crashes or accidents to occur in order to improve safety. It could be done proactively. So that is where we are moving towards Recently, I would say in the last year or two, we have moved away from the 4 E's and towards the safe systems approach. So as you can see, maybe like 2 years down the road, or when you're attending the TRB annual meeting in Jan or the year after that, you will see a more discussions on the safe systems approach and a little bit of less discussion maybe on the 4 E's. But still, the 4 E's, they form the crux of safety, or in my case of the safety research that I do. And it's 7:54 or 4:25. So I will pause here and take any questions, or yeah, I can stay for a little longer since we didn't have since I had some technological difficulties. If you have any questions or comments. So I will pause here and take any questions you may have.
Thank you for that interesting session, ma'am. We're grateful for the time and the effort you took to deliver the session for us. Now the forum is open for discussion.
Sir, you can unmute yourself, sir. Very good, sir. You can unmute and
Can I ask?
Sure.
Yeah.
please.
Yeah. Good evening, Professor Alluri. It's an excellent presentation. I really like the way you went about it. I have a couple of questions to ask you. One is regarding that fatality scenario in USA. You showed very interestingly for the last decade, since 2015 or so, from 10, there was a good decline up to 2015, and again it shoot up quite a bit right now, as we saw 2022, if I remember correct, it is around 46,000, but 46,000 plus. And despite you have moved, as in India also, we have moved on the same page for safe systems approach only we are trying to follow since 2020. But even then, except for the COVID year, as you rightly pointed out, there is a sharp increase in the fatalities. There is a crash has shown some sort of a saturation, but fatalities have shown a severe increase in Indian scenario, especially the last data which was recorded in 2022. What I want to ask you is, despite your move for a safe systems approach, how USA or in general, why the states are performing badly in your view in USA?
That's a very good question, and there is no easy answer for that. What I have been following is that the US Department of Transportation has been making policies in order to improve safety. And that is why you could see a sharp decline in crashes. And the way I see it is like we have captured all the low-hanging fruit. And now we have to do something drastically different in order to improve safety. And the COVID year has wreaked havoc in how we drive in the United States. But compared to the pre-COVID, now people are much more aggressive, and speeding has become the most contributing factor, which was not the case before. So there has been a change in the driver behavior and the type of crashes. So that is why we are focusing more on, actually, I don't want to say this, but focusing more on enforcement and education and a little bit less on engineering. So because people, actually, to tell you the truth, sir, people have been speeding, and I think speeding related crashes or fatalities increased 10 times or something. I don't remember the number, but it's
So that is happening more on the freeways and the county roads rather than on the city roads. That is a major scenario contributing to the fatalities and serious injuries.
Kind of, but the local roads, they don't contribute to too many fatalities. Speeding occurs everywhere. Speeding occurs everywhere. For example, the road that I take to my home, the speed limit is 35 and everybody goes at 70 miles per hour.
Oh God, so that's that's
Yeah.
crazy. Okay, I thought that's a rampant phenomenon in India only, but it is not the case because when I went to San Francisco and all, that area I found largely there is people are abiding by it, and there are some locations where speeding does occur. He used to say that's what I found it. But one thing, how do you take how seriously road safety audit is practiced in the USA in various states across?
Yes, a very good question. Road safety audits are taken very, very seriously, and they are done. Yeah, I mean, the agencies do a lot of road safety audits, and they do them very often, and the recommendations are almost always addressed by the
Okay,
state
that's
or the
good.
funding
Thank you.
agents. Yes.
Thank you. Thank you.
Any more questions?
Hi, this is Niju from Kerala Road Safety Authority. Thank you for the wonderful presentation. I'm sorry for the mess and the sound around because I'm in a public transport. Modification factor, in fact. Do you have any standard guideline or document which says each to have this percentage reduction, like
Nicho, I think it is this is Nicho. Can you just text it up?
sorry, 1 second.
Nicho, it was breaking actually. You can just repeat.
Yeah. Come again?
Nicho, probably you can text the question. That's better.
Yeah, voice is not clear at all.
He's on his way back home, right? Maybe in time. Samson sir, any comments, sir? Please.
Like a listen, that was a good presentation. I'm very happy. Priyanka, I'm sorry that listen, I'm not there in the office today. I'm traveling that way. Fine. Probably listen, by considering the Indian condition, what suggestions you can give to improve the safety aspects of Indian condition? Okay, you know the conditions in India as well as from US. What listen to the suggestions or the takeaways which we can improve, because listen, Velmurugan is there in the national level committees and all.
That's a good question. I feel that among the 4 E's, all 4 E's are equally important, but just based on my experience in India and the research that I do here, I feel that there are a lot of low-hanging fruit in order where we could improve safety in India. For example, signs to make sure that people don't run off the road when you have a horizontal curve, or the sign when you have a divider, or street lights, or pedestrian signals or crosswalks. I think there could be a few countermeasures that are low cost but highly effective countermeasures that could be installed to improve safety. For example, on rural roads, I don't travel much in India, so I don't know, but maybe on rural roads, maybe installing rumble strips along the certain corridors so that people don't run off the road. So those could be some of the engineering countermeasures that are not that that are less expensive, but they give the most return on investment. And also, I think India is gearing more towards the safe by changing policy, which I'm very glad to see that policy-wise as well, India is moving towards improving safety. And as it was mentioned, maybe safe systems approach, thinking about it from safe systems approach is also the right way to go. And of course, following the traffic rules. Yeah, I mean, in the US, I'm sure you are aware that if you break a traffic rule, it has serious consequences. I mean, the ticket, the ticket price, the points on the driver's license, the hike in the insurance, it's a ripple effect. So people tend not to break the traffic rules, but I don't think that is the case in India. So I think some sort of more standardized enforcement would help. So I think there is no one way or one strategy, one approach. But when we look at the 4 E's, maybe going through each one incrementally could improve safety. I'm not sure if that is what you're expecting, but
yeah. Thank you, Priyanka. Like, listen, that is the right answer. But still, what we feel, even in your case, you mentioned that, listen, the posted speed at on your road to your house is 35 miles per hour. And you said that the people will travel at 70 kilometers per hour. But Indian condition, listen, if it is 35 or 40 kilometers per hour, they will travel at 100 kilometers, 120 kilometers. So enforcement is very, very important. And as you mentioned, these signs, markings, all those things, it improved a lot in Indian environment. But the issue is that people are not following it, or the enforcement is not that strong. So that is, maybe in Kerala, just I wanted to mention that, listen, we have installed that cameras at different locations and all. But the data is coming, but the enforcement or the challan ticket, this one fine and other things, implementation is a big task, especially in Indian condition. I don't know. Well, but you can probably listen. You can give your these things. Now, this is a challenge. I agree, fully agree with that. Thank you, Priyanka.
Thank you.
Thank you for
yeah,
for
that's the
sharing
correct
your.
way to go about this. That's right.
I'm myself, Ebin Sam. I had raised a important thing that all the 4 E's are working in silos. In India also, the same thing is happening. So based on the US experience, how we can work together to reduce crashes? How the agencies or departments are working in coordination in US so that we can take some inputs from US experience.
Within the United States, I mean, we have several funding agencies. I mean, I have research projects at the city level, at also the district level, which we call, I mean, Florida has like 8 districts, and at the state level and at the national level. So we have a lot of peer exchange where we have research projects, where we have people on the research panel from multiple states. So we try to address the needs of multiple states so that they could use the results directly. So that's one thing that I like about actually working in Florida with the Florida Department of Transportation, is that they are very implementation oriented. They want to do a research project, but they want to make sure that even before the research project is completed, they want to make sure that the results are implemented, that the agency can use the results.
That's very interesting.
Yeah, we call them preliminary results. And for example, I present for at least 4 or 5 of my research projects, I need to submit preliminary results and present them to the entire state and to other states for sometimes, and they're going to use those numbers. Say for the CMF, they're going to use that CMF while justifying installing mid-block crosswalk like next month. So we work a lot with the agencies to make sure that the research is implementation ready. It's never a research paper. It's never just a final report put on the shelf. So it has, yeah, so I think the implementation aspect is huge, is very important, especially within Florida, for example. And peer-to-peer exchange is also plays a vital role. Say, for example, FDOT has peer-to-peer meetings with other states. And then when they go, they need to present what they are doing. And they come to us, to me, for example, as a researcher, to say, hey, Dr. Alluri, what is the status of this research project? I need to present to the federal government about the status. Give me a few slides. And then I prepare the slides and they present and they come back with comments, and so it's a very robust network, if you will, where we share research results as we are conducting the research, and also have some lessons learned on how we implement or conduct research. I don't know if I answered your question. I may have gone off a tangent, but yeah, let me know if you have a question.
Yeah, yes, ma'am. Yeah, peer-to-peer exchange and the engaging with stakeholders, and it's very much important. Ma'am, one more question which that Dr. Niju Irrigation has asked, the director of KRSA. He has texted me. He asked that regarding the crash modification factor, whether there is any standard guideline available in US so that we can adopt it in Indian conditions.
Oh, yes, definitely. I mean, what you could do is you could Google CMF clearinghouse. Let me see if I can actually find it. Let me see. Okay. Yeah, so it is called CMF clearinghouse. It's I can put it in the chat. Let's see if I can actually put it. Yeah, so this clearinghouse has all the CMFs that have been developed in the United States over the past 20-30 years. So all you need to do is type up the name, and then you get the clearinghouse, the CMFs, and you have several information about how to develop CMFs, how to use the CMFs, how to implement, or how to basically use the CMFs. So I think this is a very good resource. Say, for example, if you want a CMF for red light cameras, right? That which we, let's see, advanced technology. Okay. I am sure my research on red light cameras would have been here. So let's see, maybe this one. Yeah, I mean, I have to search, but as you can see, you have several authors here. Yeah, I'm sure. Yeah, maybe I have. Yeah, so I mean, CMF Clearinghouse is a very good resource that you could use. I hope I answered your question.
Yes, ma'am. Thank you.
Okay.
There is one more question in chat box, from Ardra.
Yeah.
Regarding spacing of RMC.
Okay. Ma'am, there is one more question in the chat box regarding you have done the effectiveness of red light cameras. So is there any guideline regarding the optimum interval to place the enforcement camera so as to maximize the compliance level?
That's a good question. I don't know the answer, and I don't think that information is publicly available. I don't think the agencies or the people who are complying with this would share that information, because then people are going to misuse that information. But actually, the short answer is we do not know how their algorithm works.
Thank you, ma'am. Any other questions from the audience?
You can go to the next thing, event thing. I don't think any more questions are there.
Thank you, ma'am. Now I would like to invite Mr. Shivit PP, Junior Scientist, Traffic Engineering and Safety Division, NATPAC, to deliver the vote of thanks. Over to you, sir.
Good evening, On behalf of NATPAC, I would like to express my sincere gratitude for each one of you for joining the TransTech on the topic improving transportation safety, bridging the gap between research and practice through the 4As. It has been an interesting and outstanding session. First and foremost, I would like to express my deepest appreciation to our distinguished speaker, Dr. Priyanka Alluri, for sharing the valuable research finding with us. Thank you, ma'am, for creating a detailed awareness about the 4Es like engineering, enforcement, service, and education in road safety. And we understood that these 4Es are really important in reduction in the crashes and road safety. And your case study also really wonderful. And once again, thank you, Dr. Priyanka, for delivering such a wonderful presentation. Next, I would like to express my sincere thanks to all for your participations. And we had a very good interactive session today. And our heartfelt thanks to Dr. Velmurian sir from CRRE and Mr. Niju and Ms. Kala from ARSA for your active participation and interactions. And furthermore, a big thanks to our director and division head and each coordinator from NATPAC for making this.
Thank you. Thank you.
Thank you. Thank you so much.
Thank you for that. Thank you.
Thank you.
Thank you,
so
Priyanka. Thank you very much again. Thank you all.
Thank you.
Thank you, Dr. Priyanka. Thank you.